Ladies and gentlemen, welcome to today's webinar titled Navigating the 2025 CMS 855 Forms Update. This webinar will be presented by our industry expert, Toni Elhoms. Toni, welcome to the program. We are now ready to begin.
Thank you so much for that introduction, and thank you to all of our attendees today. I'm so excited to talk to you today about the CMS 855 form updates, also known as the Medicare enrollment form updates, specifically for 2025. So as our moderator mentioned, my name is Toni Elhoms, and I'll be your presenter for today's session. So we're going to be talking about the provider enrollment process at large. I think it's always important to just kind of touch on some of the basics. We'll talk a little bit about what's going on with PACOS 2.0, 2025 updates. We'll talk about some of the changes, and then we'll go through the enrollment forms and talk about some of the more complicated sections. So when we look at provider enrollment, making sure that you've got the most up-to-date information, healthcare providers decide whether or not they want to participate in Medicare. When we look at the different statuses in Medicare, specifically PAR, non-PAR, and opt-out, if you do nothing, Medicare Advantage requires a contract with a private insurance company in order to treat those patients as in-network providers. Part A is going to be for inpatient care, and then for traditional Part B, that's when you're going to be looking at the 855B, the 855I, the 855O if you're just ordering and certifying. Medicare Part C is going to be Medicare administered through private health insurance companies. And then, of course, D is going to be for your prescriptions. Medicare is participation-based. Medicare Advantage is contract-based. Let's talk a little bit about the modalities for completing these forms. PACOS is the Provider Enrollment Chain and Ownership System, PACOS. The nice thing about when it does get rolled out is it's supposed to be super intuitive. One thing I wanted to talk about, we've already talked about it a little bit, is the different form types. Some other ones that are not as well known are going to be the 1561, which is the Health Insurance Benefit Agreement. You want to make sure you send them to your Medicare Administrative Contractor. Don't send them to CMS, and make sure that you're sending it to the correct mailing address. And then make sure you've got all your ducks in a row with your documentation. So all your providers' information, if you're trying to track this down, it's going to be a nightmare. So there's still utility for both the forms or the portal. Either one is fine. You use the portal. This is what it looks like. You've got to have your own username and password. You cannot share these. The authorized official, which has the most access, that's going to be someone that is a CEO, CFO, board chair, owner. And so you can see the different access levels. Some things I want to talk about specifically that came up with regards to CMS's revocation and denial authority. Now deny enrollment or revoke an existing enrollment, meaning if they find out about it, misdemeanor convictions, it would be based on the effective date of the conviction date. These are, again, all new, fairly new changes. Stay of enrollment status to help with deactivation and non-action, so they do have that new status declared. Another thing that's new is all suppliers and providers are required to report changes in practice locations within 30 days. If you need to find any NIPS or MPI records, you can go to the NIPS website, MPPES National Plan. Data.cms.gov has a really nice revalidation lookup tool. So a lot of people are like, where do we pay the fee? How do we do it? We're coming up on time here. With Form 460, this is the PAR participating provider agreement that you have to include with your 855 application. And then this just gives you some information about what it means to be non-PAR versus PAR. Make sure you include the EFT authorization agreement. Make sure you check everybody's credentials. Missing or most common things that I see, missing signatures, so the wrong people signing off and the authorized official or not signing off at all. You do have to be the authorized official, sign off on these applications. In some instances, they'll ask for the delegated official as well. And then make sure that you have someone look at your application if you're filling it out, because it's easy to make mistakes. You might not pick up on those things. and then just make sure everything's accurate and consistent. I told you I'd probably go till the end. Thank you so much for your time and attention today. I really hope that this has been valuable to you. Thank you so much. I appreciate it.
Thank you, Toni, for this amazing webinar. Ladies and gentlemen, this is a conclusion for today's webinar titled Navigating the 2025 CMS 855 Forms Update. To disconnect, you can simply hang up. Thank you.